Hi, everyone. Thank you for being here. Before I hand it over to Dr. Roussin, I just wanted to express sympathy to all of those who have experienced COVID firsthand, and also to all of those who have had the experience of losing a loved one. This is an emotional time for all of us, and it's a fearful time for all of us. These fears are real. Today's announcement is in part a way to address those fears, to give confidence to Manitobans that we are doing everything we can to address and prevent the challenges that COVID has given us, but that doesn't change the fact that it's had its consequences in a real way for Manitobans and for people around the world. Brent, thanks for joining me here today, and thanks again for all your work, and over to you for your daily update.
Thanks, Premier. We are advising of a 12th death related to COVID-19 today. This is a male in his 60s from the Grey Health District in the Southern Health Region. This is a previously announced case connected to a known cluster, and the individual was hospitalized and in the intensive care. I want to extend my condolences to the family and loved ones, as well as our condolences to the family of the 2 deaths we announced earlier this week. Our current 5-day COVID test positivity rate is 1.8%, with 15 new cases of the virus being identified as of 9:30 a.m. today, bringing our total number of lab-confirmed cases to 763. The data is showing that these 13 new cases were in the Prairie Mountain Health Region. Preliminary investigations indicate that these are connected to known cases. 1 case in Southern Health and 1 case in the Winnipeg region. We have 6 current hospitalizations, including 2 individuals in intensive care, 223 active cases, and 523 individuals have been listed as recovered. And our total number of deaths related to COVID is at 12. We're advising of another potential exposure event to COVID-19. This occurred on August 13th and 14th, 3 p.m. to 10 p.m., and August 15th, 3 p.m. to 7 p.m. at the Wigwam Restaurant in Wasagaming. The risk of transmission is considered low, but information is provided to help people assess their risk and seek testing should symptoms develop. Our testing numbers yesterday, preliminary numbers indicate 1,376 lab tests, taking our total to 118,364. Again, reminding Manitobans to only go for testing if you have symptoms related to COVID or have been directed to go for testing by a healthcare provider. Asymptomatic testing has a limited use. We use it for certain surveillance purposes. Reminding employers as well to not require asymptomatic testing for their employees prior to attending work. Our system is not set to accommodate time-sensitive asymptomatic testing requirements that are set out by employers or businesses, or to those individuals that require this for the purposes of travel. So at those testing sites, please bring your health cards for quicker identification. We know that staying home when you're ill is a paramount strategy that we need to be adhering to right now, and will certainly be a major issue when we move into respiratory virus season. So again, reminding employers to work with their employees to ease the burden of taking time off when they're sick. We want to encourage people to be away from the workplace when ill. And I know Manitobans are anxious about the numbers that we've seen as of late, but they also know that we have these concrete steps that we can take to reduce our risk. We can focus on the fundamentals. Those fundamentals is what flattened the curve in March, April, May. We know to stay home when we're ill, even if mild symptoms. Practice good hygiene, hand hygiene. Do not share items with others, and practice physical distancing outside of your household. We're also advising Manitobans to wear a mask in indoor public places, especially when physical distancing can't be assured. These fundamentals will again help us flatten our curve. You can find further information at manitoba.ca/COVID-19, and I'm going to pass it back to the Premier.
Thanks again, Dr. Roussin, and thank you on behalf of all Manitobans for your tremendous work. Your work's been integral in giving Manitobans a greater sense of confidence and safety and preparedness, and that is vital in these times. Dr. Roussin knows, as we all know, that panic is not a plan, and your work has replaced the possible panic with greater certainty that Manitobans need and deserve to have at this unprecedented time. We have a plan. That's the purpose of today's announcement. To set the stage, I would repeat, early and decisive actions, along with Manitobans' hard work and dedication to those fundamentals Dr. Roussin referred to, has made a difference in our fight against COVID. And we all have the opportunity to save lives, and we have, and we'll continue to do our best to do so. Overwhelmingly, Manitobans have stuck to the fundamentals. They have followed the advice of Dr. Roussin and our healthcare experts. And because of that, Manitoba's response to COVID has been as successful as that of any jurisdiction, arguably, in the world. But for that to continue, for us to continue to be one of the safest places for our citizens in this country, we have to remember and remind each other of those fundamentals on a regular basis and continue to abide by them. Aucune jurisdiction n'a eu autant de succès que nous. Le Manitoba continue d'être l'un des endroits les plus sûrs au monde contre le COVID-19. Our government's number one priority has been and will continue to be to protect the health and well-being of all Manitobans, especially our most vulnerable citizens. And as we continue on our roadmap to recovery, to safely reopen our communities, to restart our economy, we have to learn to live with this virus. We are here committed to being ready as best we can for what lies ahead, ready to live with COVID-19, ready to return to school, ready to restart our services, to create jobs for one another, and to do our best to help people get their lives back in this province as much as we can, given the realities of COVID. Nous nous engageons à être prêts pour ce qui nous attend, prêts à vivre avec COVID-19, prêts à retourner de l'école, prêts à redémarrer nos services, créer des emplois et sortir de cette pandémie. We're committed to providing Manitobans with the information they need to help them stay safe, ensuring we're better prepared to respond and navigate through the COVID challenges ahead. And today, we are proud to unveil our Restart Manitoba Pandemic Response System. This will provide Manitobans with clear, detailed, and localized information about the risks, the responses, and the recommended actions that we can all take to reduce the spread of COVID-19. This online tool is the first of its kind in Canada. The Restart Manitoba Pandemic Response System provides an overall picture of the situation throughout the province, while also providing specific targeted measures that may be put in place by region, by community, by sector, and or site. This system will be rapidly updated, so information is always timely. The system is based on COVID-19 indicators monitored by public health officials. I want to say thank you to the team throughout many government departments that was involved in the preparation of this plan, and to them say thank you so much for your efforts on behalf of your fellow citizens. Today I would also like to announce that out of an abundance of caution and having listened with great interest to the input of literally thousands and thousands of Manitobans, we will be requiring mandatory use of masks in schools in grades 4 to 12 where physical distancing of 2 meters is not possible. I should mention this would, of course, include staff in those schools, not just students. Mask usage has already been strongly recommended. In our family, when the doctor made those recommendations, they were always followed, but we want to be clear that when these doctors' recommendations are implemented in our school system, they will be followed. And so we take that step today. We continue to listen to the concerns of Manitobans. We believe that greater clarity and confidence is essential so that we take these additional measures to ensure the health and safety of our most precious asset, which is, of course, our children. Aujourd'hui, je voudrais également vous annoncer que, par prudence, nous allons exiger l'utilisation obligatoire des masques dans l'école de la 4e à la 2e. nay. COVID's not going away anytime soon, as much as we would like it to. And we all have to learn to live with this virus. The more we learn, the more we act on what we learn, the safer we'll all be. Our pandemic response system was established to ensure that all Manitobans have the most current information so they can plan, they can prepare, they can keep themselves safe by following the fundamentals and the guidance from our public health officials. That's why today's announcement is so important, because it provides Manitobans with that additional confidence. I'd like to thank our team again across government for their active involvement, and for more information on how this plan will work, those indicators and response levels I alluded to before, I'll pass it back to Dr. Roussin. Brent, over to you.
Okay, thank you. So we know Manitobans, by and large, want to do and have been doing the right things to protect themselves and their families, their neighbors, and communities. We've also heard clearly from Manitobans that they want clear, consistent direction from public health about what they need to do and what they should expect from others. We know that being in a pandemic is challenging. We all went through some challenging times in the first few months together, but our collective actions got us those positive results. The pandemic response system is our next step in guiding what we can do together to keep ourselves informed and to make decisions about our health and the health of others. The work of public health has guided the development of this pandemic response system, and public health will be making the determinations about response levels that are set for the province, for the region, for a sector, or even for a specific site. We know Manitobans want the facts about what's happening about COVID-19 and where it's happening, and this system allows us to do that in a very responsive and flexible way. So if we look at the pandemic response system, we set it out at 4 levels, and it's important for Manitobans to understand what those levels mean, and that these levels will apply at the provincial level, it will apply at the regional level, it could apply at a specific sector level, and even at a specific location. So today we're launching the province-wide system at caution, the yellow symbol, which means the spread of 19 is at low to moderate levels, and we're seeing household and close contact transmission. We are seeing community transmission, but it is relatively low and localized. And we've seen multiple or isolated clusters or outbreaks, but they are for the most part being contained. The public health restrictions that are in place at the caution level of what Manitoba is in place right now. So this caution is representing where we are currently in Manitoba. If we need to ramp up a public health response, and again, that could be for that whole province, for the region, for a sector, for even a specific location, the next level is restricted, which is orange. At restricted, we're seeing increased community transmission. We would be seeing new clusters, but again, many of these being contained through public health actions. At this stage, our health system is still able to meet the increased demands being put on it by COVID-19. The next level would be critical or red. And at this level, we'd be seeing extensive community-based transmission, and the spread is not being contained. We'd be seeing widespread outbreaks and new clusters that are not being contained. And at this point, we'd see serious strains on our healthcare system. We also need to recognize that at the current state, there's work that's being done on vaccines and searching for treatments for COVID-19. And if we do expect to get at a time where we see the transmission of COVID-19 broadly at lower levels, we expect to see possibly an effective vaccine or treatments. And at those levels, we would be at the next level, a green level, we're calling limited risk. And certainly, we all know we never live in a risk-free situation, but at green, we would be calling it a limited risk. So at that stage, which we are unfortunately not likely to see in the near future, but we would see that broad transmission of the virus is at very low levels, and that we've found ways to protect our most vulnerable, and we're not seeing significant transmission in our communities. So it's possible we could see pockets of transmission at that level, but we would not be seeing broad-based, community-based transmission. And so those are these 4 levels, and again, they will be applied at a province level and a regional level, and again at specific levels as the epidemiology provides. Public health will be monitoring a number of indicators to guide us on when level changes should occur. Again, it's not going to be the result of a single indicator that will guide us. It's the multiple indicators and trends and the current situation that will guide us to lift or to further restrict action. So, so thanks, and I think we can open it up for some questions.
I'll just wind it up by saying again, that's okay, Brent, thanks. I'll just wind it up by saying at all response levels, it's crucial that Manitobans remember to follow the fundamentals. They got us here. Our economy, our social supports depend upon this. Always stay home when you're sick, even if mildly ill. Practice good hand hygiene, regular and thorough hand washing, covering your nose and mouth with a tissue or sleeve when coughing or sneezing. Avoid touching your face. Practice physical distancing. It's critical that you do. Wear a mask in public indoor settings when physical distancing is not possible. The Restart Manitoba pandemic response system will guide Manitobans. It will instill, we hope, a greater sense of confidence during this challenging and unprecedented time. But we will be successful if we keep working together as a team, because we are all in this together. As Brent has said repeatedly, avoid stigma. Remember to be kind to one another and supportive of one another. Nous réussirons si nous continuons à travailler ensemble en équipe parce que nous sommes tous ensemble dans la lutte contre le COVID. There is fear in all of us, but there's also courage. And we need now to, in the face of natural fear, summon up the courage that we need as we move forward together with a new school year. Our children are precious to us as we move together in this time, this emotional time. Remember that we need to offer our help to our children, to our friends, to our neighbors, to help them get their jobs back, to help them be confident. Because just as COVID-19 is contagious, so too are our attitudes. And so I encourage Manitobans to look for the courage within each of us to face these challenges together, to abide by the fundamentals that earn you the sense of confidence that you're doing the right things. Thank you. Look forward to your questions.
Masks, is there any, you were asked last night and you said it's on the table, and I would not like to play poker with you because you played that very cool in advance of today's announcement. Is the government also contemplating masks in other areas where people are indoors and stationary for periods of time?
So, you know, the answer is going to be, you know, much the same, is that it's certainly on the table, that we've increased our messaging on masks over time, and right now we're clearly saying that indoor public places, you know, especially when you can't physically distance, we want Manitobans to wear that mask, and the messaging is, you know, even if you're not sure, you know, if you're not sure, if you're out at a retail outlet or a store where you can't be adequately positive you're going to be physically distancing, be wearing a mask.
Was it the public feedback that, I mean, even last night, that was the overriding theme in town hall, was the public feedback that changed the government's mind?
Let's be clear. I mean, Dr. Roussin was very, very clear last week. This is doctor's orders, strongly recommended, was what he said. What we've heard from administrators, school leaders, parents, teachers as well, is that it would be even more straightforward to simply say it's required. And it might ease in terms of oversight, supervision of the children. We hear these points, and we think within the school system where social distancing is not possible that this will make good sense. I should clarify, though, there are some cases, and this I say for parents of children with breathing difficulties and so on. I guess as an asthma sufferer myself, I'm sympathetic to this one especially, that this is, we are going to have to be able to make some accommodation, obviously, for certain students who have pre-existing medical conditions, things like that.
So
Dr.
are there
Roussin,
cases where if you can maintain your 2-meter physical distancing, that you don't have to wear the mask in school?
Well, it is, if it can be maintained, then that's ideal. But it's in those situations where it can't be maintained. We know that they're gonna do whatever they can to minimize encroachment in that 2 meters. But we know that we have that 1 meter minimum in class. And so if we can't maintain that 2 meters, then the mask is gonna be required.
So could you envision a scenario where they might be wearing masks in common areas, hallways, but then they get to a classroom where it's set up where they have a 2-meter distance between desks, they can take their masks off while they're learning in the
That,
classroom?
if that was possible to maintain that distance, and you can, we'll be working and seeing is there ways where we can accommodate, say, mask breaks, for kids wearing masks all day, do that in a safe manner. But yes, it's possible if that distancing can be maintained, then a mask really isn't required.
Dr. Roussin, you said that there's not one specific indicator that would really trigger a change. And when we talked to you in the briefing earlier, you gave us a bit of context because you've said test positivity rates you want below 3%. But can you say or give us that context again as to why that's not the only trigger point and what other things need to be taken into consideration?
Yeah, right. So, I mean, we could see a test positivity rate of say, 3%, but we know that the majority of those positives are part of a known cluster that's isolated, that's contained. Then we wouldn't necessarily rely just on the test positivity rate. We could be in a situation where we saw a test positivity rate of 1.5%, but saw widespread outbreaks and a strain on our healthcare system. Then we might have to have restrictions even with a 1.5% test positivity rate. So it really requires on what's going on in a number of those indicators.
When we're seeing what's happening in Brandon right now, and we start looking through the scenarios, many of us might think that the community scenario is something that we are seeing there. Can you say how closely you guys are watching that? And I know there's no trigger point, but
Yeah, well, I mean, we're watching it very closely. We still see that many of those cases are linked to either clusters or to other known cases. We are seeing community-based transmission. We are seeing that in Brandon. We are seeing that in Winnipeg. So it's not absent, but we're watching it very closely. And if there will be a requirement to implement further restrictions, then that could be an area where we see it go to that next level of restricted.
How's hospital capacity in Brandon right now? That would be one of the fundamental indicators you look at.
Right, and so we're not seeing a strain on in our healthcare system in any jurisdiction right now. We have 6 total hospitalizations in the province right now related to COVID. And so we're watching that obviously closely all the time, but right now we're not seeing that strain.
With regards to one of the other indicators being community transmission, I know we have seen a bit more lately. You said moving up to kind of the 18-ish% range from about 11. What would you consider kind of a higher rate of community transmission across the province that might prompt us to move into the orange zone when it's kind of not that lower level of community transmission, it's just a bit more widespread?
Yeah, and so we in our daily dashboard, we look at the number of the average amount of community-based transmission that is occurring in the last 7 days. And so when we see numbers over 40 on a consistent basis, that's starting to make us think that there's significant community-based transmission going on. Our number right now is hovering around 40, but we know that that's an overestimate because a lot of them just haven't been linked to cases yet. But that's the indicator that we're looking at.
can you talk about how this will work by being able to put restrictions on one community or one area? And you talked previously about one sector even, on how that's going to work and how that will make such a difference as opposed to just the widespread closures that we had to see in March and April.
Yeah, and I think it's as we learn to live with this virus, knowing that we're going to see this virus come like this and see peaks and likely valleys and peaks again, we need to find ways to continue to live with the virus without widespread shutdowns. So for instance, we could see transmission occurring in a specific sector, many outbreaks linked to a specific sector, then we would put restrictions on that sector while not addressing any others that we're not seeing transmission. And so it allows us to work more targeted in that approach.
So Dr. Roussin, these codes were influenced by the fire safety risk codes and the color codes and the beach safety color codes. Can you tell Manitobans what they could expect on a daily basis? You know, good morning, it's partly cloudy, it's 12 degrees likely today, and it's yellow. Like, can you just tell Manitobans how they could have
Yeah.
this communicated?
Right, and so I think that Manitobans will come accustomed to visiting our website, which they have. Many Manitobans are visiting that daily, and we'll be having that province-wide level that's documented, which is unlikely to change quickly. It's something that would be discussed over time. And then Manitobans may see certain alerts over time. For instance, an alert that we would have on there now would be the Bethesda Place care home that has a restriction on it, and because an outbreak has been declared and visitor restrictions are limited. So we'll see these targeted things, and the website is set up to highlight any changes that have occurred that day.
And I know that more travel restrictions aren't coming, forgive me, Josh, yet, but given the fact that we've got higher per capita risk here than Ontario now, is it now time to maybe get rid of the Ontario?
Yeah, and we've all seen how quickly things change with this pandemic, and it's a moving target. And so, like you said, we were a month or two ago we couldn't even consider lifting for our eastern Canada, and Western Canada was looking quite good. And now we've seen a change in some of that epidemiology. So it's really difficult to react to these ever-changing situations with broad-based orders like this. So we definitely are going to do what we need to do to protect the health of Manitobans, but implementing or lifting travel orders right now with so much in flux is going to be difficult.
How concerned are both of you that Manitobans seem to be ignoring some of the safety guidelines? I know there was an Angus Reid poll that said a third of Manitobans are ignoring those safety guidelines. We are one of second or third worst province for people just not really tending to take it as serious now, and our numbers are going up. So from both of you, is that concerning for you?
Well, on an ongoing basis, it's concerning. That's why we reiterate the fundamentals and the importance of them at every opportunity, and we'll continue to do that. We have, literally in our hands, we have the opportunity to save lives and to save our own, potentially, and those of loved ones. So we'll continue to hammer away at that point. We're not, generally, we haven't referred to polls, I don't think, as we've made our decisions. Really, we're trying to go on science, but the reality here is that everyone who disrespects these fundamentals is disrespecting their friends and neighbors as well, and that's, I think, a legitimate point to make. We expect that when the doctor makes strong recommendations, that those would be followed, and we're going to continue to make those strong recommendations in respect of the fundamentals of preventing COVID cases.
Do you think a sort of simplified color coding system will encourage more people to be aware of the rules and abide by them because they don't want their specific community going orange or red?
Well, I think we wanted the messaging to be simple and clear and flexible and responsive. So I think that does just that. And then I think that having that green in there, knowing that we're not at that level now and may not be in the near future, shows us that we're still cautious, that we're with this virus. And we expect this curve that we're in right now to start flattening again, but we're going to still be in that a cautious zone because this virus isn't done with us.
Is there any danger of areas such as Brandon or the Niverville health area slipping into orange at this point?
Well, that's, watching it very closely. So we're seeing those numbers that are rising in certain areas, certainly like in Brandon. Like I said, we're able to link that to clusters, to other cases, but watching it very closely. And yes, if we felt that that things were not contained and restrictions were required, then that's precisely what this would be for. We would go to the restricted level and impose further restrictions.
How fast could that happen? Obviously, for the Bethesda Place, that can come into effect pretty much overnight. There's an outbreak, very straightforward. But say you were to say, look, cases are rising, lots of community spread, we're gonna put the province or a community into the orange, how fast could you enact that? Would it be kind of overnight, or would it be a few days out, you're gonna say, okay, on Monday, we're gonna roll back?
Yeah, I mean, I think it could be enacted as quick as would be required. I think if we were looking at reducing things like group sizes and restricting businesses, then we would, you know, do whatever we could to engage again and you know, give that notice that we're really considering that.
With the system.
Sorry, Josh, I'm just going to add to that if I could. I think, and also in reference to Steve's earlier intervention, that public awareness piece is really critical. We repeat these messages at every opportunity here. I thank you and the media for repeating these messages when it is appropriate and through your reporting. But that's part of the Restart Manitoba ad campaign as well, to reach out to Manitobans who may not be following these press conferences, who don't subscribe necessarily to your paper or watch your broadcast on television, and to reach out to them as well. We need to get that word out there. And we also need to get that word out to small businesses around the province. We've been doing pretty well helping get people back into work, but we've got 40,000 reasons to try to encourage our programs and our small businesses to use those programs. And so this is what Restart Manitoba is about. It's about recognizing we're all in this together. Public health improvements will improve the abilities we have to give tens of thousands of people an opportunity to get back to work in our province. They're not separate, they're symbiotic, and that's the purpose of our promotional campaign. I can't think of anything better to promote than public safety at a time like this, and I believe that giving people the opportunity to work in our province is important. But Manitobans need to know they have a say in this, and if they follow the fundamentals, they can help, and if they don't, then they're hurting. So we need to get that message out repeatedly, and it's clear that it, as he said, it's not getting through to everyone. So we need to continue to repeat the message, all of us.
Mr. Premier, on that, this message has been out there since March, April, and the way you guys have gone about it so far is education, education, education when it comes to people. Would you like to see, or is there the potential that you see where we actually start enforcing some of these with fines and other measures if people, I'm talking residents, not businesses, continue to kind of snub their nose at some of these health regulations, especially when we look at polls where there's 28% of people who actively defy these health regulations?
Well, I think that it could be argued that our method has worked better than most other jurisdictions' approaches. We have continued to repeat the message. I'm not one of those former teachers who says I taught the kids and they just didn't learn. The fact is you have to repeat the message. You have to take, sometimes it takes years to get a message through to a student on something. It's going to take a while for all Manitobans to start to get on the team here. We're not going to give up on Manitobans, and we're going to continue to use educational means as our primary way of convincing people that they need to do the right thing. Most people are complying. Most people in Manitoba do get the message, but we can't give up on our friends and neighbors who don't. The consequences of their actions are real for the rest of us, and I think it's important that we continue with those approaches. That being said, we have added significantly to our supervision, our fining capacity, and we have had well-reported instances of serious deterrents to having to be issued. It's disappointing that has to be the case, but we'll continue to work both ends of this. But I would emphasize it's not one or the other. It has to be both.
Mr. Premier, any update on the Pan-Canadian sick leave program? Has there been any kind of further steps on that? I know we're hearing from some people that obviously the messaging is stay home when you're sick, but some people still feeling like they're kind of forced to choose between paycheck or staying home.
Yeah, and look, Ottawa's been in a little state of flux lately. We all know that. Christian Freeland and I have communicated on this issue. I and Premier Horgan led the charge on this thing. We need to have a sick leave program nationally, and it needs to include parents where their children are sent home from school as well. It has to be broad enough that it doesn't deter people from staying home when they're sick or reporting that they're sick. We need a program that offers encouragement, not discouragement. I was pleased, and I thank Ottawa for accepting the responsibility of running the program. That was good. That was a month ago now. Land the plane. Let's get the program in place here, because we've got a need to make sure that people are not encouraged to go to work ill. And this program, one-time program for this purpose, funded by Ottawa, not by small businesses, they got enough on their plate right now, is the right way to go. We just need that program to be launched. So I was planning to go to Ottawa this week, obviously, because of circumstances beyond my control. That wouldn't have been appropriate given the changing responsibilities that are currently underway. But in the near future, I expect, we have in writing already drafted communication on the priority here that we feel has to be addressed, and that's a national sick leave program. Yeah.
And has this all been delayed now since Parliament's been prorogued till September 23rd?
I wouldn't associate the prorogal, I wouldn't associate the shutdown of Parliament with this. They can initiate a national sick leave program while prorogued. They don't need legislative approval, I'm told.
Is the province providing masks to schools and students, and if so, how much money's been put aside for that?
Yes, they will be providing masks. I think that the message will be for students to provide their own non-medical mask when possible, but will be provided for those who cannot. I'm not aware of the financial aspect of that.
Calvin's our education minister is going to have more detail to share with you in the not too distant future on a number of fronts.
Thank you, Premier. We're going to go to the phone for a brief moment now. First up will be CTV Winnipeg, Jeff.
Hello, gentlemen. Jeff from CTV Winnipeg. Dr. Roussin, I have a question about the mask mandate. My memory of the school plan was that for high school students, they would be physically distanced by 2 meters, and that's why some of them would have to be at home to make that space available. So why would they need a mask? Is it because of hallways? Is it because when they're walking around? Can you maybe just explain that one? Because I understand a lot of the other kids in other grades would only be 1 meter apart, but why for high school students?
Right, and so they're only mandated to wear masks when physical distancing isn't possible. So if they're in a situation where physical distancing is possible, then they won't be required to wear that. But like you said, masks and are common areas, halls where it's less difficult to control, then they'll definitely be required. If a classroom, it can be assured that people are seated at their desks and they're 2 meters from everyone involved, then that may be a situation where you won't be required to wear a mask during that situation. So the message is when that 2 meters can't be maintained, you must wear a mask. And
Mr. Premier, with the response system that you've unveiled today, and I asked this in a technical briefing, but I'll give an example here. If a town or a municipality or health district, if there was such a large outbreak that you needed travel restrictions there, how would that be handled? Would it be a quarantine? Would it be some sort of enforcement? And who would be responsible for that?
Yeah, it's a great question, Jeff, and it poses some challenges. We actually were talking about this earlier today. How do you close off Westwood if there's a concentration of cases in one part of the city, and it's going to be very, very challenging. Let's face it, with clusters in a close rural environment, something that could be more possible. We're going to have to cross that bridge when we come to it. I think, Brent, you could add to this.
Yeah, I mean, certainly the Public Health Act allows travel restrictions within Manitoba, so that would be the method of enactment. But how we would actually go about enforcing it would have to be worked out through many levels. But as we saw during our first few months with it, most of our orders were complied with. We didn't have a lot of fines or enforcement that we needed to do. So it's something that we will have to deal with if it ever comes down to it.
From City News, Stephanie.
Hi there, Stephanie Lasuk with City News. I apologize if you addressed this already. There was a reporter on the line who didn't mute their line, so I couldn't quite hear. How will mandatory masks be enforced in schools, and will students be sent home if they refuse to wear a mask?
Yeah, I mean, I think that this is an issue. When we mandate things, we have to start thinking about exceptions. So we are going to be providing the list of circumstances where in certain individuals with medical problems that may not be required to wear a mask in those situations. And then it'll be, we'll be working with the divisions and school administrators on how best that could be enforced and how we could assist them with that.
And I'd add, Stephanie, that, thanks on behalf of Minister Gertzen to all of the divisional leaders, trustees, parent councils. We've had tremendous involvement in the preparation of our back-to-school plan, and on an ongoing basis that those exchanges, that dialogue, that input that we've been getting from our educational leaders has been really helpful. I know that our educational leaders are preparing for many different challenges with this school year, obviously, and this is one of them.
And you were concerned about privacy and stigma if you guys released too many details about a particular cluster. But with this new system, it looks like those clusters will be made very publicly available. How did you kind of reconcile that concern?
Well, I mean, it's a balance, right? We're balancing Manitobans' need for information to guide their plans and our entire province's response and to live with this virus. With the very real issue of stigma, and we've seen examples of that. But I think, when we're looking at a number of cases that are in tightly linked clusters, Manitobans are going to need to be aware that that's not really community-based transmission. It's a very tight-linked cluster that we've identified, and I think Manitobans need to know that to help guide our plans forward.
From CBC Radio Canada, Ezra.
Hi, my question is for Dr. Roussin concerning yesterday's town hall. Sir, yesterday you were talking directly to Manitobans and to parents, and obviously it's not the same emotional exchange, between reporters and parents. And I want to know what did you get from those exchanges with those real people, let's say real people, real parents? I mean, what did you get from them?
Yeah, and so we've done a number of town halls during this pandemic with, like you said, to listen to Manitobans, and and I don't think there's probably been a bigger issue or a bigger emotional issue that we've had to deal with yet than the return to school. I think that there's parents are anxious about returning their kids to school. So certainly we heard a number of concerns about how best to reduce the risk. Certainly about masks was a very big theme on mandating masks. And we just heard that people are paying attention to this virus, and they want what we want, is the safety of our children and of staff, but they all know the importance of our kids getting back to in-class learning.
Just to add to that, Ezra, we had more than 19,000 Manitobans participated in some manner in the call last night. We had over 30,000 parents completed the school reentry survey earlier this summer. We had 800 questions so far submitted to Engage MB, and I would mention to parents who have additional questions, they can visit engagemb.ca and they can review previous answers. They can submit new questions. We're working very hard to make sure the communication is there. We're, as you know, from the rollout of our previous phases, we've involved Manitobans at every step of the way. We've adjusted our planning according, to some degree at least, to the input that we've received, and the consensus where it's evident on issues has helped us to make a plan that I think not only makes sense from a science base, but makes sense in the way in which it's been communicated, in uplifting the confidence of Manitobans that it's their plan. And because they've had ownership of the participatory process, there's a better chance that we'll get compliance. There's a better chance that we'll get understanding at the very least of what the plan entails.
Thank you.
All right, thank you. We'll go back to room 68 to the News Conference Theater now.
With the technical briefing you talked a little bit about signage and placards and for communities and businesses. What's the plan for visible reminders of what the status is or what the response is for different places and businesses?
So I mean, I think right now we're certainly going to be updating that. The website is the primary form of that right now. As we start, if we get into restrictions in certain sectors or certain businesses, and that's something that we're going to be working and engaging with those sectors on how best to communicate that. So I don't think we have any definitive decisions on that, but that will be something that we want to ensure we're communicating to Manitobans.
We have
Mr.
some,
Premier?
I'll be adding to that next week with some additional information pertinent to that issue, Carol.
Mr. Premier, with education, the federal government recommended masks, they're now mandatory. They recommended ventilation, which is part of the plan, may even be funded, Minister Gertson says. They also recommended smaller class sizes, and that's not part of Manitoba's plan. Can you comment on the decision not to look at smaller class sizes here?
Well, we've maintained the class sizes. We're going to maintain the fundamentals. The fundamentals are 2 meters. That is possible, will be possible in a number of venues. It'll be difficult in others. Where it's difficult, where it's impossible, we're going to be using masks. As far as, changes on the fly to create new ventilation systems in schools, it's not possible to do that in the next 3 weeks, and I think everybody understands that. We're working very diligently with the resources we have, and there'll be more to say in respect of additional resources. There was last night, and there'll be more to say in the coming days as need arises. We're working in partnership with our administrators, our school divisions, and so we're going to be ready to respond when challenges around resources arise.
Are all the cases being announced, Dr. Roussin, today confirmed? Because we used to get a breakout of presumptive cases. And so are they all confirmed now?
That's right, yeah. So typically our testing regimen now is that because our labs have tested so many that we're just confirming them in-house. So the positive tests that we receive, we consider confirmed. We'll sometimes have cases that are removed because they were residents of another province, or sometimes we may have a probable case where a person's test is not back yet, but they were a close contact to a case. Now they have symptoms and have been tested, so we might count them as a probable case. If that test comes back negative, then we might remove that number.
We're not getting probable numbers.
No, these are confirmed cases.
Okay.
Yeah.
Dr. Roussin, getting back to the pandemic response system, and this was hinted at when Westwood was mentioned, but how are you going to tailor your responses for a region, a city as large as Winnipeg?
Well, it's going to have to make sense, right? And so if we have remember that when we see, we don't break down the numbers of cases in a smaller geographic area than, say, in Winnipeg or than Brandon, right? Because remember that these, the places that we get, that's their address, a case's address. So you might live in North Winnipeg but work in West Winnipeg and visit family in South Winnipeg, and so just because we have a number of cases in North, doing something specific to North Winnipeg, it probably won't make a lot of public health sense. But if we see a widespread community-based transmission in Winnipeg or parts of Winnipeg, then probably the public health intervention would be all of Winnipeg.
So we're not going to wall off Wellington Crescent, for example, or, sorry, I'm picking on the Premier being here, but it's not like there's even the possibility of regional travel restrictions.
No, they'd be extremely unlikely to see that within a municipality like that. It might involve an entire municipality, with it, or a larger region. But to see the public health benefit of that, I can't see a situation where that would work.
But what about for a place like Niverville, Rashad, the health district? I mean, both Niverville and Rashad are both saying, it's the cases aren't here. It's, but you can't say where specifically. So how helpful is that to people when they hear that and it's in either of the places in the name?
Yeah, well, I mean, this is what we're talking about. The health districts sometimes don't have great names with it. And then we're back at that balance of identifying certain groups and the risks and benefits of doing that. And so we're continually learning. We're continuing adapting, and I think that we've come a long way on reporting geographically, and I think we're going to continue to try to give Manitobans as clear a picture as we can about where these cases are and the effects that they may have on them.
With respect to Bethesda Place, sorry if I missed this earlier, is there still just that one confirmed case there, or has it spread?
There's only the one confirmed case in the resident at this time, and we've started a testing campaign of all the residents and all the staff, as well as any potential connected visitors.
One of the indicators that you're going to be looking at to assess risk and response is the percentage of case contacts that public health contacts within 24 hours. Where's that? That's obviously a very important part of contact tracing. Where does that stand right now? What percentage of contacts are being contacted within 24 hours?
So our guidepost on that is 90% of contacts being tested within 24 hours, and we are right now, our rolling average is 87.1%. And so some of that has to deal with the certain clusters and reaching within them to get those contacts identified. So for the most part, it's with these cases and there, it certainly puts a strain on public health seeing this many cases, but we've been still able to reach almost 90% of contacts within 24 hours.
And you have the resources still?
We're still managing at this point. We have had to revamp our contact center because each of these cases and contacts, we contact daily, active daily monitoring for them. So a contact will have to self-isolate for 14 days. So public health actually contacts them every single day to review symptoms to ensure they're self-isolating. We now will run that through our contact center to give up more time for contact tracing.
Is that how you can
Rolling average
determine?
is 7 days.
That's right.
Is that how you can determine when someone's recovered now? Because it's that 14 days after the symptoms disappear, and if they're not going and getting retested, how do you guys actually count how many have recovered?
That's
then?
right, yeah. So what we know is that from the evidence, typically 8 days after the symptom onset of the symptoms in a case, they are unlikely to be infectious. So we're actually moving at 10 days after the onset of symptoms. Those people are determined as recovered. We don't need to retest them, and so that's in almost every circumstance. That doesn't change the incubation period, so contacts still have to self-isolate for 14 days.
Have we seen anybody in the province that has gotten this virus twice yet?
Well, there's been people that have tested positive twice, but it's unlikely that they were infected twice, because that's the downside. This test is so sensitive that a person, even though you're not infectious after about 8 to 10 days after onset of symptoms, some people will continue to test positive weeks after that.
Is there any lack of shelter space for self-isolation in Brandon?
Well, right now, our alternate accommodation centers are still at good capacity, so we're not running into that issue right now, but that's another indicator we follow.
We're up to we're up to 60 positive cases now at Maple Leaf, according to Maple Leaf. Are you still confident in your decisions regarding its operation?
So we're meeting twice a day with Maple Leaf and following these cases. So they may be, the numbers that I had yesterday was 56 total cases, and there's probably some of these Brandon cases are positive, but that was 36 active cases. So some people already have recovered from there. And so we have been working with the Chief Occupational Medical Officer, working with CFIA, as well as Manitoba Agriculture, really in daily and often twice daily meetings. And so the safety protocols in place are above and beyond. We still don't have direct evidence of workplace transmission. A lot of these people are connected in the community to cases. But we are working with testing strategies and how we could ensure we're doing what we can to limit any spread within that facility.
With regards to recoveries, you explained the process for people who are symptomatic. When someone tests positive but they're asymptomatic, do you just go off of, okay, they're recovered 14 days later?
Yes, 10 days, would it be right now, yes, barring anything else. So we'd be contacting them daily. If they should develop symptoms during that time, then it'll be 10 days from the onset of symptoms.
Your mask mandate follows what a lot of other provinces are doing, but maybe can you just explain to people why it's not mandated for the kids in the younger grades?
Yeah, and so I think that there's two factors in that. Probably the biggest factor is the likelihood of adherence. So to mandate mask wearing in a 5 or 6 year old and then try to enforce that is going to be a real challenge. In addition to that, we know that the younger the child, the evidence is showing there's less risk of transmissibility between them. So those two factors are go into having some sort of cutoff to the age.
But not saying from a parent, if you're comfortable or maybe you've been teaching your kid, they could also wear one to school.
Absolutely. So on the bus or in the class, if they were deciding to wear a mask, then we would certainly allow that.
Is there going to be a campaign to educate parents and kids about proper mask use? Because I think of a 10-year-old going to school for the day, they're going to have that mask on and off, in the pocket.
Exactly, and as our messaging is for adults too. We all see people with the masks, but the nose out or the mask under their chin. So so we're going to try to provide a lot more public information on the proper mask use, what makes up a good mask, because we're talking about non-medical masks often. So yes, so more to come on that. We want to make sure everyone's for these to work, we need them to be used properly.
Hence the reason for Restart Manitoba and the campaign that we're engaged in.
Dr.
To
Roussin,
educate people on the fundamentals and to encourage people to adhere to them. And this is a very good additional rationale for that campaign.
Well, it sounds like the messaging is moving away from the economic side.
Not moving
although
away
still
there. It's not moving away from it at all. They're in tandem. They're exactly the same message. If we improve our practices of adhering to the fundamentals Dr. Roussin has been espousing, we'll improve our economy. If we don't adhere to the fundamentals, we will not improve our economy, and we will keep people out of work who would like to work. So the two messages must be delivered simultaneously. That's what the ad campaign is about. That's what the public awareness aspect of this is about. It's exactly about those things.
Dr. Roussin, talking about the targeted approach, we've identified like Bethesda Place as a higher risk. And in the system, are we looking at doing that with every place that comes up? Like, why not the Maple Leaf Plant in Brandon? Why not this Wigwam restaurant? Why shouldn't they go up to, say, Orange, for example, if there's that potential risk of transmission in those places?
Right. So if we felt that, so in this situation, the Wigwam restaurant, because of the nature of that exposure, is a low risk. So we provided advice to that business, but our advice wasn't to shut down or to restrict. If it was, then it would pop up there. Same thing with another business. If the business had public interaction that warranted it, then we certainly would list it here.
I'll close off by just saying thanks again, Dr. Roussin, for all your work, and to say to the family and friends of Dale Howarchuk, we are offering our condolence on behalf of not just Jets fans, but all hockey fans. You're a Hall of Famer in every respect, not just a Hall of Fame hockey player, a Hall of Fame human being. And Ducky, we're going to miss you.
Any plans for college to honor him in some way?
We'll talk at an appropriate time.